Gonzalez is here with us this evening, and we're going to be having a conversation, then open it up for questions afterwards. And I'll give you a little bit more of an indication why we're talking about this. This is our first one of these Just Talks. And the reason we started with this is because it's been an issue that we have quickly attached onto as this new little church as a way to engage in this community. But there's other ones that we have planned, and there's other ones that we want to plan. And so we hope that this is just like the pilot of something that is ongoing, not only for us as a church, but for us as a community, to be able to engage in these types of conversations that are important, but aren't necessarily happening. So to bring people together around these important conversations for Richfield, but then also for the area as a whole, the Twin Cities, and maybe specifically even the Twin City suburbs. These are issues that are ongoing and we ought to discuss so we can work together too. So we are going to have that conversation. This is a church, however, and at least at this point, these discussions are happening within the context of a church gathering. And so we're going to start off with a couple songs. Those of you who are comfortable with engaging, you're welcome to do so. If that's not your jam and you are here for the discussion, you're welcome to sit back, and there's 2 songs, that's it. That's all you have to sit through. Fair enough? Okay, great. Have Ben come up, and then we'll get going.
How new is the church?
I'll address that. Very new.
All right, for those of you who want to stand and worship, let's stand up. beauty that made this heart adore you. Hope of a life spent with you. Here I am to worship. Here I am to bow down. Here I am to say that you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me. King of all days, oh so highly exalted, glorious in heaven above. When you came to the earth, you created all for the sake you came for. Here I am to worship, here I am to bow down, here I am to say that you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me. From heaven knows how much it costs to see my sin upon that cross. I'll never know how much it costs to see my sin upon that cross. Here I am to worship, here I am to bow down, here I am to that you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me. Here I am to worship, here I am to bow down, here I am to say that you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me.
All right, we're going to do one more churchy thing. In some traditions, they call it passing the peace. Why don't you say hi to some people next to you? You might know some of these people. Some might be brand new faces. This is a different kind of context. So say hi to some people next to you, and then we will get going.
Yeah.
Still recovering.
Yeah.
Still recovering from what's not going to win.
Yeah. I don't know. I don't think that's so bad. It's kind of like.
That game was
Right. You're like, why is that?
You might think so. No one should know. You should feel bad if you do know.
Yeah, it was like, I did so poorly. Yeah. I was so sleeping right, and I was so bad.
Yeah, it's not your-
Like, not only have I
You're
double
talking-
wrong, which I felt like a trouble
It's undergrad.
I don't play spoon with my family.
All right, we can take a seat. For those of you who haven't seen it, there is water and coffee out in the front entryway. You can leave at any time, they'll fill up. There's also, the bathrooms are just down the hallway on the left. Women's is first, men's is second. If you need anything else, I don't know, Diane. I don't know what else you need, but you can find most of it out there. So answering Lee's question, as he asked before, Community Church Richfield is a new church. And by new, we mean we've just been up and going, at least meeting on Sundays weekly since the beginning of the year. So January 3rd was our first weekly gathering. And it looks probably a little bit different from most people's perception of what church ought to look like, whether you've been a part of a church before or not. And in a lot of ways, that's intentional. And I try to get up here on most weeks, if not every week, and say Sundays is one of the things that we do. Many churches spend the majority of their time and money and staffing and facilities towards this big Sunday thing. And that can be all well and good, but we really want to be a church that is in this community, that is with and coming alongside the people and the groups in this community. We want to be of this community. That means long-term, we want to be made up of Richfield people. And then for this community. We don't just want to be existing for the sake of existing. We want to be making very tangible impacts on this community and the people who are here, coming alongside other people, coming along other groups in order to make that happen. And so it means it looks different on Sundays, it looks different during the week compared to what most people would expect. This is a type of conversation, a type of event that most churches wouldn't be doing, and yet this feels really natural to us. So we hope that this is just the first of many of these types of things that we have alongside other people and alongside other groups right here in this community to make a tangible difference for the well-being of this place and the people who are here. We've gone about that in a few different ways, and there's some announcements up here that kind of get at some of those things. We have these active groups which meet the first and third Tuesdays of the month, at least. They've been doing this over the summer and over the fall. And these are ways for us just to get out into the community and have fun. So we've done things like yard games. We've done ultimate frisbee. This past week we did board games. It's just a way for us to be present and doing things with this community and in this community and alongside people who are here. Another thing that we've been doing, and actually we've gained some people specifically through this, it's the only way perhaps they've heard about us, is we've sold these shirts, and Maria happens to be wearing one of these shirts. Called Love Where You Live, and it's an opportunity for us to sell these shirts that talk about, that have these things listed on them, that people who are from Richfield have said, this is what we love about this city. But on top of that, all of the profits that we make off of these things go towards a local ministry that is doing things in this community, actually loving people in this community. So the most recent one that we've done is selling these shirts to go towards raising money for the Richfield Dual Language Schools backpack program to help provide meals over the week, or at least provide some food over the weekend. One of the things that we did earlier in the spring was raise awareness about and raise and gather supplies for the Spartan Food Shelf, which is out of the Richfield High School. And so over our brief time here, we've kind of noticed some things that have happened in the community, or that maybe have been lacking in the community, and tried to ask, are these real needs, and how can we leverage the assets of this community to help go about covering these needs. And so these are small things that we've done, but as we get more into this process, thinking more critically about how we can contribute to these things, we also want to be asking questions about whether this is about us or actually about tackling this need. Is this actually moving the ball forward in this conversation, or are we continuing to perpetuate this same thing over and over and over again? And so that's one of the reasons we're having this conversation tonight, is because we want to get down to what is food insecurity? What does that even mean? Because for some of us, you might not know what that term means. I didn't know what that term meant 3 years ago, probably. So we're going to talk about that. We're going to talk about root causes, like what leads to food insecurity. How have people tried to address food insecurity, maybe in good ways and not so good ways? And long-term, what are things that we can do together as individuals or as organizations in this community or across this region to be able to contribute to long-term solutions? So I'm not an expert in that. So we brought in an expert on that. Maria Reagan Gonzalez is with us tonight. I'm going to let her introduce herself. So Maria, why don't you come on up here? Why don't you welcome Maria?
Thank you, everybody. I'm Maria. I definitely don't feel like an expert on this topic at all. I am just a very passionate Richfield resident and somebody who has a lot of experience working on food issues in communities here in Richfield and in different communities in Minnesota. And I work on some issues at the state level, and I work on food insecurity issues here locally in Richfield. And Jeremy and I met and we talked a little more about that. So I'm more than happy to share what I've learned and kind of some resources that maybe can help this group think about what are some ways to really start addressing issues of food insecurity in our community. And I really respect the fact that you guys are thinking a lot about what are ways to make sustainable change. And not necessarily just focus on charity, which is really great and needed, but also like how can we make sustainable changes in addressing the root causes of issues like food insecurity. So I will be talking a little bit about that today.
Great. Just so you know, Matt is going to be clicking, so we've got all your slides in. So as you need them or want them, let him know.
Okay.
Also, we do want this to be a conversation. So between the two of us, I'm going to be asking her questions and she's going to be responding. But also, if you have things, if you have thoughts, if you have questions along the way, write them down or remember them. Do your best to remember them, because then at the end we're going to have a little bit of time for question and answer with you and Maria, so we can discuss what might be on your mind. That make sense? Okay. So Maria, why don't you just tell the group a little bit more about yourself and what you do and what got you interested in this stuff to begin with?
Well, let's see. I mean, food was always a really big part of my family. So my mom is from Mexico City and my dad is from Aurora, Minnesota. And food was just, home cooked meals was very important and something that we always gathered around and built community around. But then I went to school and I got my degree in international studies, and the focus of my degree was international food policy. And I started to learn about how specifically in the United States, we really subsidize a lot of our exports, food exports to other countries so much. We subsidize it so much that it costs less money to purchase some of the staple grains than it costs to actually produce it. So it putting a lot of farmers in other countries out of business and perpetuating inequities globally. And so I started to get into the world of food policy and working alongside farmers in Mexico and Ecuador. And I said, why am I in these other countries working with farmers to be more sustainable when it's the policies and practices of my own country that are putting these community members in this situation? So I came back and I started to work with farmers here locally in Minnesota who were interested in becoming organic producers, but trying to figure out how to do that viably and financially as well. So I'm just thinking of all the different things. So I worked with farmers for a while, and that kind of led me down this path. In addition to working on food and farming, I've also worked a lot with immigrant and refugee communities, but I could never land a job where I could work with my own community and on food issues. It was a lot of times maybe rural Minnesota and working on food issues, or working here in the Twin Cities on maybe social services or different things like that. And it was really tough for me to find something where I could do both. And I landed a job at the city of Bloomington in their health department, working with immigrant and refugee communities, all residents actually, Bloomington and Richfield and Edina, on healthy food access and food issues. And it was kind of my first job where I was able to work on food issues and work with multiple communities. And through that, we did a community food assessment, which I can share more about. But food and farming is a personal passion of mine. I think it's something that's a great equalizer. All of us as humans enjoy food, and I've seen just a meal bring people together in a way that nothing else can, and it's something that we can all share with one another. And in my job at Blue Cross Blue Shield Center for Prevention, I also now work across the state of Minnesota to help on healthy food access issues. So I used to just focus in Bloomington and Richfield, and now I work across Minnesota. So it's a professional passion of mine and something that I love, but also personally, it's one of my favorite things to do. My husband runs a farmer's market in South Minneapolis, and I try to go there as much as possible, and we love to cook, and that's a little bit about my experience around food issues. And I've also been involved with the food charter, which I'll share a little bit about today. That's a great place that you guys might want to start to investigate where you might want to work on more.
Awesome. This is tangential. Mexico City and outstate Minnesota, what were like staple family meals?
They were, yeah, we had hot dish, and we had like enchiladas and pozole. very, very interesting. So
Any enchilada hot dish?
no, we never mixed them. Our Thanksgiving meals were kind of interesting.
All right. So I think next we want to talk about like defining it. And the terms, how many of you have heard of food insecurity? Okay, or hunger. Some people talk about food deserts, which I know you have a feeling about that. So why don't you tell us briefly? I've been using this term for a while now, and some of you might not even know what I'm talking about when I talk about food insecurity. So how would you define food insecurity?
Can you go to the slide where there's actually a couple of definitions if you want to go through? That's some of the past. Can you go back for a second? That's some of the work that I've done with farmers and farmers markets and stuff that I was talking about. And then the next slide has some definitions, but food insecurity is basically not knowing when your next meal is going to come, if you're going to have a next meal. So uncertainty around food in your meals, and hunger is the actual sensation and feeling that you get. So one is more of a social condition, and another one is almost like a physical feeling. So these are definitions that I pulled from different sources. And then food deserts, they had their definitions define food deserts in different ways, but basically it's a community that doesn't have access mostly to a grocery store within a certain mile radius, and that mile radius can change. But I don't like to use food deserts a lot, because in a lot of the federal studies or grants that mention food deserts, they really just related to grocery stores, sometimes restaurants. But that there can be communities where they might not have a big grocery store or restaurants outside of fast food restaurants, but they could have a great, like a robust food system in terms of markets, or people can have a lot of gardens. And so some of those cultural connections to food that I think are things to be recognized in the term food desert it's very limited. So when we think about healthy food access, there's so many ways to get access to food, and the food desert description just doesn't really, it's pretty narrow. So that's a little bit about the definition. So food insecurity is really the social condition of not knowing where your food is going to come from and when, and your next meal will be. Hunger is the sensation and the actual feeling, and food desert is a term to refer to a community where there's not really a lot of access to healthy food close by.
Right. Do you want to just start going by your slides?
Sure.
Would that be helpful?
Sure.
So why don't you go to the next slide, and then I can ask, well, here you go. We've got a video that,
Yeah.
what is this video?
So let me just give a little information. So I'm not trying to sell the Minnesota Food Charter to you guys, but I definitely want you to know about it and kind of learn about it, because there was just a process that was finished, I think a year or two ago, where thousands of Minnesotans across the state gave input to what would a Minnesota look like that has a healthy, robust food system where people can get culturally appropriate, healthy, affordable foods, and what does that look like from the consumer and the person eating the food all the way down to the producer. And so there's a lot of work that has already been done with the Minnesota Food Charter, and it kind of gives the big picture context for something more local once we start talking about the food assessment and kind of the issues here in Richfield. So I wanted to play a little video. And I don't know if you guys know Gary Eichten from he's the voice on this, but it gives a nice overview, so you can watch that.
The land, the people, the traditions, the food. For those of us who call Minnesota home, there are many reasons to love this state of ours. And one characteristic of our state is our ability to come together to solve problems. Yet a challenge that continues to confront us is access to safe, affordable, healthy food for all Minnesotans. Today, the cheapest foods are often the highest in calories and the least nutritious. For all Minnesotans, and even more so for Minnesota's low-income families, healthy food may not be affordable or even available, and many rural residents need to travel miles to purchase fruits, vegetables, and other healthy foods. The consequences of these challenges to healthy food access are real. This means many of us struggle in our day-to-day lives, at school, work, home, and in our community. Over time, a lack of access to affordable, safe, and healthy food leads to chronic diseases like diabetes, heart disease, and certain cancers. And while many farmers and food-related companies want to grow and prepare healthy foods, there's that need our attention. The truth is, our economy, where our food comes from, and how we get it, as well as our personal health, are all interconnected. Now we're proud to introduce the Minnesota Food Charter, a document that guides you in making healthy food available to more people. The charter will offer healthy food policy and system solutions to improve access to healthy food in our schools, child care centers, workplaces, healthcare providers, hunger relief programs, communities, and stores. Anywhere food is produced, processed, distributed, and enjoyed.
Despite the fact that we have lots of agencies and lots of organizations working on food issues, we still have a lot of people who are not getting access to safe and healthy food. What the Food Charter does is take all of these efforts and synthesize them in a way that people can understand. It helps to get organized the efforts of all of these multiple agencies. This is going to make the efforts a lot more effective on everybody working in the nutrition and food distribution systems.
The Minnesota Food Charter is a result of hundreds of listening sessions, online town forums, as well as interviews with a diverse, very, very broad group of people, thousands of people across the state.
Food is such an incredible part of us, obviously, just ingesting it, but it's a part of our society, connected to our energy use, connected to our society, I think, in ways that sometimes we don't suspect or understand. And the Food Charter, I think, is it's a way for me and for, I hope, all of us to look more critically and carefully at food and its interrelationship with our lives.
As a leader in government, local government, not even thinking about that there's a potential for us to improve the food systems, whether it's a transportation system or the pathways, walking pathways, bike pathways, all those things, if enhancing them and making sure people can get to food sources.
Many of the reservations, they have similar transportation issues. The grocery stores are small, they're convenience stores, they have a lot of prepackaged processed foods. And while it's convenient, it's not always the best food for you. And that came out in the Minnesota Food Charter. So it looks at how do you impact that and make healthier choices in your community to increase access to better foods.
In North Minneapolis in particular, we have on one of our main corridors 37 unhealthy places to get food and one grocery store. So access is a huge issue. I believe wholeheartedly that if people had healthier options and increase in the number of healthy options, that they would make better choices.
Community members can begin to see that, oh, I've been trying to increase food access from purely a anti-poverty perspective. And then you'll begin to recognize that others are suggesting the same thing from a health perspective or from even a transportation perspective. And that we've been working in silos and we need to see the commonalities and leverage those common benefits.
I think it was really interesting with the food charter
how all the different perspectives of people seeing a little piece of the food supply from their own perspective work. And it's really a wonderful document because it brings all that input from all those perspectives together with a real understanding of the food supply.
The Minnesota Food Charter will help us leave a legacy of healthy food access for future generations and make Minnesota a more prosperous place for all. Explore the Minnesota Food Charter at mnfoodcharter.com. Find out what you can do and go make it happen. One person, one organization at a time, we can make a difference.
So that's a little overview of the Minnesota Food Charter and the efforts that happen behind it. And there is some food charters. Do you know where they are? There's one there's the other ones. So there's some food charters that are circulating maybe and food charter planning guides too that you guys can just check out. I didn't have enough copies
There's like
everywhere.
5 of these in
Yeah.
the room
So
somewhere?
this is a food access planning guide, not a food charter. There's a food charter. There's 2 food charters and 3 of these. If you guys just want to pass them around and check them out, you'll see what the food charter looks like. So the food charter has 99 strategies or recommendations that came from residents across Minnesota about what could be done in these different areas. So food infrastructure, food skills, and that's something that the group could start is, by looking at it and seeing if that's something that you guys are interested in, or maybe something more localized could be an option too. And then the food access planning guide is a guide focused specifically on city planning and the intersection of planning healthy cities and healthy food access. And that is a really good opportunity. I'll talk more about that because there's a perfect opportunity coming up with our comprehensive planning updates for the city that we could influence in terms of healthy food access using this guide or the work that you guys will be doing on food insecurity.
All right, I want to break something down from that.
Yeah.
And ask a direct question. So there's a guy on there who says, thousands of people are working towards food types of things, and I don't remember the language they used, but basically not
in silos or something.
They're in silos or they're not actually contributing towards long-term solutions. So like, what are the actual causes and what are the underlying issues that these thousands of people are trying to address through whatever they're doing, but aren't actually getting at the things that maybe the food charter is trying to? Does that question make sense? Causes and underlying issues that are contributing to food insecurity.
Can you go, I think the next slide answers that. Okay, you want to go to the next one, this one. Okay, so like many issues, root causes of food insecurity, I mean, there's so many causes. And so I work in public health, and something that we call these root causes are social determinants of health. So why do people have poor health as individuals? Why do people have poor health as communities? Because there's these social factors that influence our health. And so the majority of our health is not determined within the walls of a clinic, but by far and large, the majority of our money as a country goes to hospital functions, clinics, and patient care, but that is not the majority of what causes our health. So behaviors cause our health, environmental factors, income, all of these things influence our health. And so these are some of the root causes of food insecurity as well. So I think one of the biggest things, and I think this is a root cause for many, many issues, is poverty. And, I think about efforts to increase the minimum wage. Wages have been stagnant for years and years, and people continue to make expenses go up, and people continue to make very, very low wages, and that impacts so many things: transportation, health, education. So I would say that is one of the biggest root causes. So when you guys are thinking about how can we influence it, I know there's faith-based groups working like with Isaiah and others to increase minimum wage. That could be one direction that you go in. There is a direct correlation between chronic disease and food insecurity. So, a lot of times we think about hunger and maybe food insecurity. We think of somebody who doesn't get enough to eat, but part of it is also not getting enough of the right nutrients to eat too, and having a lot of access to high calorie, nutrient poor foods like fast foods. So it's a very lucrative business to have sick people and to, be on the end of providing services and treatment and prescriptions for a sick society. And it's a lucrative thing for a lot of companies, and that's something that I think we put a lot of money into servicing this whole cycle versus addressing it. And that, I work in public health and we have a tiny little sliver. That's the root causes. I work in addressing root causes, which is the majority of what influences health, but the majority of our federal funding and country's funding does not go to public health. It goes to medical health. Yes.
I can't see that graph. Can you explain that graph a little bit?
So this talks about subsidies, the crops that our country subsidizes for farmers. And so then it's also connected. So another root cause is it's much cheaper to produce and buy and use soybean, corn, things made of derivatives of corn, wheat, high fructose corn syrup, because of these government subsidies that farmers get. So that's another root cause as well. So farmers who are producing healthy food, vegetables, whole grains that are not refined, they get there's a tiny little sliver, which is that little green sliver. That's the amount of financial support that they get from our federal government. And those big pieces are dairy and grain, soybean, things like that. So even the way that our federal government subsidizes what farmers are growing and not growing affects immediately or directly impacts what we have access to. It's a lot cheaper and accessible to get refined foods, things with a lot of sugar, things like that.
Thank you.
And then in our society, just living a quick, fast-paced life and convenience is highly valued, and there's all kinds of factors, but sometimes we think about what impacts healthy food access maybe in a very limited way, but there's all of these social determinants that really impact healthy food.
I'm going to go back a few slides to that. I think it's underlying issues. So the issue suburbs.
Okay, so the Minnesota Food Charter the video played it out for you in terms of the state level. So in terms of the suburbs, I don't know if you guys know this, there's been a couple articles in the past couple of years in the Star Tribune and more information coming out on this, that the rates of poverty and food insecurity in the suburbs are growing at a much quicker rate than in Minneapolis and St. Paul. So it always used to be opposite. But now what we're seeing is there's a lot of kind of gentrification in Minneapolis and St. Paul, where it's becoming very expensive to buy a home, to live, to work directly in Minneapolis and St. Paul. And people who have higher incomes are moving in, and a lot of community members who have lower incomes are moving to the suburbs. And so now we see kind of the inverse of what happened several years ago, where people were moving and building homes in the suburbs, and a lot of the low-income communities were in Minneapolis and St. Paul. Now we see the reverse, and now we see the effects of this as well in the suburbs. So Richfield is a part of that. So I don't have a copy of the food assessment, but one of the things we did a couple years ago was the Bloomington, Edina, and Richfield Community Food Assessment. And the main question was how affordable, available, and accessible are healthy foods for low-income residents in our 3 suburban cities. And I was leading this project, and I was talking to Jeremy, and it was a really great project, but something that I was personally really disappointed with the project was some of the limitations that included. We did not have the funds or the time, which I didn't think was a good enough excuse, to be reaching out to communities who didn't speak English. We didn't involve families or children, so it's very specifically focused on English-speaking adults in Bloomington, Edina, and Richfield, which we know, especially in Richfield, we have a very diverse community, and the issues that multiple communities within our city face could be very different. And so I think there's some limitations to the study, but we got some really good information. So I think the next one talks about specifics. So, Jeremy asked me, why should we care about this? Why is this an important issue out of all the issues? So I think in any organizing work, it's important to find your personal reason and interest for advancing an issue. And I think the same is true for food insecurity. So what are the reasons that you are personally connected to food insecurity and personally vested in that? What I have here today is just kind of, and I think a lot of you guys know this, is the effects that hunger and food insecurity have on our children and our adults. So we know it's a fact that children who face more food insecurity and hunger are more likely to be hospitalized, higher risk of different health conditions, have lower quality of life, they have higher risk of having behavioral issues, and then this translates into school issues as well, and being truant, tardy, potentially having just behavioral issues in the classroom as well. And then in adults, if you can go to the next one, adults who are food insecure or are hungry, again, for overall health, mental, physical health, the stress tends to be higher, prevalence of chronic disease, obesity rates, and just more difficulty managing chronic disease. So these are very much like effects of food insecurity and hunger. There's many reasons, and I think it'd be great for the group to really have more discussions around why does this group care about food insecurity. But these are some of the effects that happen when we don't address these issues. I'm trying to remember what other questions. What is the next slide? I don't know. What is one of the questions?
Well, the community food assessment, it is fully available online. So when she told me about it, 3 months ago, something like that, I was able to go and find it online. What I will do is I will provide a link to it on our website for those of you who are interested to be able to go on and look at it for yourself. And the nice thing is, I don't know if you know this, not the same as Richfield, and Edina is not the same as Richfield. Believe it or not, for those of you who know the different communities. And so it actually, all of the communities and the numbers and all of that for the 3 communities, but it also breaks it down for each of the individual ones. So if you're not really too concerned about Edina, I mean, we should all be concerned about these issues wherever they're at, right? Yeah, maybe not. If you want to specifically look at each of those different communities, it's available for you to be able to break them down.
I didn't share the findings of that.
Yes.
Let me share the findings of the food assessment. So we had, I used to know all the exact numbers, but we did this a couple years ago now. We had several focus groups, we did many interviews, and we had meetings from organizations who served low-income community members who worked on food access issues. So Loaves and Fishes, VEEP, organizations like that in the 3 cities. And kind of like the food charter, we did this broad community input process, and then we looked at the information. And what we found is that in the 3 cities, none of them are really considered food deserts. There's in Richfield we have the Super Target, there's Walmart, there's a Cub, there's grocery stores pretty close in Richfield. It's not, neither of the communities are communities where there's really no grocery store for people within a certain radius. That's makes it unavailable. And then we also have farmers markets in all the communities, and there's a lot of different programs like Meals on Wheels and Loaves and Fishes. So in some communities, there really isn't access to a grocery store or all these different food services, but that's not the case in the 3 cities. But what we did find
was the only determinant for food access, like the existence of grocery stores?
No, so we did look at I'm trying to remember, we call them community food assets. So grocery stores, and then farmers markets, food shelves. I think there was like food stands sometimes that go in parking lots, and I'm trying to remember what all included, but in the food assessment you'll see there's a key and it lists all the different things, and you can see where they are all distributed. It's interesting.
There are maps that show at least where they were, what was it, 3 years ago?
Yeah,
Something like that?
and most of the things are still there. And so what we found is, the 3 cities aren't considered food deserts, but and healthy food is readily available overall, but it's the #1 barrier is affordability for the residents. So while people, are able to go to the Cub or whatever grocery store is close by, it doesn't mean that they can afford to purchase it. And so that was the #1 barrier. And the second barrier was mobility. So specifically people with limited mobility and seniors. If you think about where some of the grocery stores are on these big streets, we have Nicollet, Penn Avenue, where there's multiple lanes. Crossing those multiple lanes, we talked to a lot of people saying that, they didn't feel like the crosswalk time was long enough for them to get across all of those lanes. They didn't feel safe. So getting to the sources of healthy food was the next biggest barrier. And then in terms of recommendations, and this is kind of what I found living in Richfield and working for the 3 cities for the past several years, there's a lot of resources in our cities, in our community here, but what I see is those resources are not being reached by everybody because those different programs or services are really not doing a great job of reaching who the community is today. So for example, in the Richfield school system, we have 71% kids of color, and a lot of community members and families that I talk to are wanting to know about more activities for their kids where they can get healthy food. These programs are out there. It's not like they're missing. We actually really have good services. The issue is that we don't have multilingual staff. We don't have, there's not a lot of efforts being made to reach out to some of our newer residents. And really, it's not even new residents. This has been happening for many years. And so one of the main recommendations is to just work with existing programs to do a better job of reaching out to different populations. So one of the examples that we actually did a couple years ago was work with Fair for All, which is a program where you can get fruits, vegetables, and meats at a 40% reduced price once a month at the Richfield Community Center. And it's all the same brands that you can get in the grocery store, but the Latino community didn't know anything about it, and they were, coming to us saying they were very interested in the program. And so we did a couple tours, and people told us their reactions, and we asked them to try to navigate the system without any help to see if people were able to do it or not as newcomers, and it was difficult. So we looked at how culturally appropriate the food was, the advertising, the staff, and so now the work continues, and what they decided to do is first start by bringing somebody from the Latino community who they're based in Church of the Assumption, gets Fair for All packages from the site and brings it to the community with the end hope of eventually kind of merging the two and community members going to the site. But Fair for All does have to make some changes to their programming, and they're interested in willing. But those are some of the things, and I could go on about different programs around healthy food access that we have here, but they're just not reaching out all to our different community members.
So we've got, let's say, 3 more minutes, and then we'll open it up in case people want to ask questions.
Can we
what else do you have?
I wanna share where to start. Okay, so this is a really, really huge issue. It's a systemic issue, and it has to do with so many different things. So it can be really overwhelming to figure out where to start. So one thing I think that would be just a recommendation is to just check out the food charter and see what you think. All the food charter recommendations are not programmatic. They're very focused on policies or changes to structures or organizations that are going to advance healthy food access. So they're more sustainable types of recommendations. And see if you're interested in the food charter strategies and picking one and going from there. Or you can look at the community food partner or the community food assessment for Bloomington, Edina, and Richfield, and see if anything resonates there. There's existing groups like the Metro Food Access Network, where it's a network of organizations that meet on a monthly basis and have these conversations and partner. Another cool thing, so I have a community organizing background and I love to do one-on-ones with community members and get to meet people directly and learn what issues are. So you could talk to school liaisons, you know, everybody, if you guys wanted to go out into the community, you could go and say we're each going to do 4 interviews about and ask these questions. That would be another interesting perspective to take. And then think about why does your group want to do this and how could that guide what you focus on? Do you really want to focus on youth? Do you want to do something that's very Richfield specific or East Side specific? And then how far upstream do you want to go? So that means something that's more downstream is really, maybe serving food at a food shelf where you're helping out, but it's not very sustainable. It's something that's going to have to keep moving forward. Or something that's very upstream is right now the city of Richfield and all the metropolitan cities have to do an update of their comprehensive plan. And the comprehensive plan gives the vision for the next 20 years for what Richfield's going to look like: zoning, transportation, land use. And so that food planning guide is specific to communities who want to improve and increase healthy food access within the context of planning of a city, which is perfect time because right now, I would say probably next year, the city of Richfield is going to start asking for community involvement in their comprehensive plan and making some very concrete recommendations or having discussions with community about how could we increase healthy food access and incorporate it into the comprehensive plan could be an option too. There's a lot of things going on. There's a lot of resources, so I don't think you have to start from scratch. It's just really figuring out how, what do you guys want to focus on and why. And going from there. I think that's the main stuff I want to share.
Fantastic. So we've got about 5, we can go longer than 5 minutes if we need to. Any questions for Maria about any of this?
Well, it seems like, okay, there is no desert here. It's accessible, it's available in Richfield. So then it doesn't exist, the food insecurity in Richfield, or we're just not reaching it. So then my question is, okay, I've got $5 a bag of apples and a bag of lettuce. Where do I go with that $5, that bag of lettuce and that bag of apples? How do you get that? Besides knocking on your neighbors, which I always suggest or recommend, letting them know you've got food available that's healthy food. What do you do with that $5, that bag of food?
So for the first question, it does exist. It's just the barrier is not that it physically, that there is no food in the community. So that's not the issue. So food insecurity does exist. The number one barrier here is that even though we do have access to grocery stores and healthy food, people can't afford it. So it's just out of reach. Second one is getting to it. So mobility and access issues. So food insecurity does exist here. And the number one reason is because people cannot afford healthy food options. And then can you, Tom, rephrase the $5?
Yeah, what do you do? It says, where do you start? Well, where do you start with? You got $5. What organization is the best one to give that $5 to, or that bag of fruit?
Donate money to?
Yeah, or
I don't know.
You know what I'm saying? And then how come there's all these food resources available, these networks, the food programs? It seems like that percentage is more than enough to cover what is needed. Why is it so separated?
So this is kind of, Jeremy and I were talking about this a little bit, but it relates to this. So Minnesota overall does so great. We have, as a state, we have, the Twin Cities system has the most bikeable communities. We have the best parks in the nation. We have healthy residents. We have really good outcomes overall as a state. But when it comes to low-income communities and communities of color, we have some of the absolute worst outcomes. And so I think this shows the same thing. So we may have a lot of resources for the community and services, But again, depending on who you are, if you're low income or a community member of color, those things aren't reaching you, they're inaccessible to you. And I would say that that is one of the biggest issues that we face here in Minnesota is we have a lot of resources and great things going for us if you're part of the mainstream. And we know that the face of Minnesota is changing and our systems are not built to include all of the different community members. And I would say it's the same for food insecurity. So we do have programs, and I don't know if all those things address those issues, and if it's enough. There are things going on. You know, even in the food charter video, it said people are working in silos. That's another thing. I talked to Loaves and Fishes in the food shelves. Their demand has been increasing and increasing, and people are just trying to just meet the demand. They're not necessarily networking with others and partnering and things like that. They're just trying to keep their doors open or meet the need. So those are some of the issues that we face.
Okay, thanks. Yeah, I think that, and then I'd be interested in your perspective. It's really not surprising, but interesting that the food assessment didn't work with people, like especially the non-English speaking, which is like really prevalent in Richfield. But I guess even those, like the Latinos that are getting access to those programs, whether it's beef or whatever, like, or Fishes and Loaves, like it's, yes, they're meeting the immediate need of like providing food for hunger, but like what's the sustainability perpetual cycle? So I think like what, in your opinion, being a Richfield resident, being here, being in kind of in tune with specifically the Latino or low income population in Richfield, how does that start, or where do we go to move beyond just like make sure people have food, but we also want to move forward with that, and like, so how do you, I don't know if you have, I mean, I'm not expecting like
I think about this
but like
a lot.
that's my frustration is
yes,
we have our kids at RDLS, and I know they're getting the backpacks, which is good, but like at the end of the day, like where's the relationship happening to like really help empower, especially that population that are maybe undocumented or whatever, but how do we as a community move forward to sustainability? I don't know if you have some thoughts on that.
I think providing opportunities I think mentorship is so important. I've had a lot of strong mentors in my life, and I would not be where I am today if it wasn't for those mentors. And I think building relationships and opening opportunities for education and internships and leadership opportunities. So I used to work for, I worked with the city staff in all 3 cities, and there's so many people retiring in our city governments, and I think this is going on everywhere. The baby boomers are retiring, and how do we support our youth to have the tools, the leadership, the confidence, everything they need to be our next city planners, to be our next council members, to be our next board and commission leaders, and trying to find ways, I think, to support youth and not just youth, but there's a lot of moms and parents and people that I talk to who want to get more involved in their community, but they don't know how. I think making those connections are huge, and growing leadership through, whether it's through a sports association or just being those bridge builders. That's kind of how I consider myself, as a bridge builder, because those are going to bring opportunities for better employment, better opportunities overall in general. For people. So I think those are the ways to do it, I guess, that I think about.
Anybody else?
I'm more than happy to, as you guys have these conversations, just be available to help troubleshoot or connect with any groups or organizations.
Absolutely. Well, do you have time afterwards in case somebody wants to come and talk to you afterwards? Okay, so Maria will be available after this. It's 6 o'clock, so we will let you go. Appreciate you coming here tonight. As I said, this is an important conversation for our whole community and for us as we try to answer the question that Matt is raised, and that I think we're all trying to figure out. How can this be a sustainable long-term thing where we change some of the social systems that perpetuate this as an ongoing thing? How can we as a community of faith contribute to moving the ball forward in that direction. So this is the beginning of a conversation that we hope to continue, not only with our mouths, but with our hands and our feet. Next month, I don't have a date down yet, but next month we are planning on doing another one of these on a pretty timely topic that has consumed some of the presidential cycle this year. We're going to be having the director of Arrive Ministries, which meets here in this building, to come and talk about the refugee crisis. Because there is so much information and misinformation that is being thrown around the media and by other means. And so he's going to come and talk to us about what does this actually look like? What do these people actually look like? They're not just Skittles. I don't know if you've heard this past week. They're not just Skittles. These are real people, men, women, children. And so how do we, as a community that we are increasingly seeing these people come into our community, what does it look like for us as people in this community, and specifically for us in this church as a people of faith? How do we have these conversations, and what do we do going forward? So keep your eyes open, ears open to hear about when we end up scheduling that next month. All right, well, let's give Maria a hand, and then yeah, we'll be back here next week. Community Church Richfield, back at our normal thing. So
it'd be good to like pray for the food of your neighbors and stuff in the church setting.
Sure.
Maybe.
Yes, let's go ahead and pray. Great. God, I thank you for the people in this room and for the opportunity for us to come together and to have a very important conversation about a very important subject. And God, we pray that you are guiding us as a church, us as a community, to move this ball forward, to acknowledge the needs of the people around us, to acknowledge the positions in which we find ourselves and how we can leverage the assets that are in this community to help to close the gap between the assets and the needs. And so we thank you for the work that Maria is doing and that the people that she's associated with are doing, for the organizations that are already here. And we pray, Lord, that you help us to come alongside others who are here already doing great things, and potentially even use the networks that we have, the resources that we have, to do something ourselves as well. God, we lift up this evening and this week to you. May we glorify you in everything we do as we go out from here. In Jesus' name we pray. Amen.
Thank you. Yeah, that was all.
Did I hear you're at the U?
Yeah.
What do you
I
think?
think
So yeah, this was interesting. Just, I mean, I
appreciate you.
and understanding, but
Right.
when you ask that question.